secrets to unlocking the ultimate pelvic floor strength is the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. When it comes to pelvic floor strength, a lot of times people think about kegel, but the reality of it is the strength really, as far as the deficiency that I see that heavily contribute to the strength of the pelvic floor, I have to go after the hips. Why? Because the positioning of the hips and how they are connected to your pelvis, how freely movable they are when they need to be, and how your pelvis itself can do its movement without relying heavily or looking for the hips or your lower extremities to cue the movement. Those are perhaps the most challenging things we see in our practice when it comes to pelvic floor dysfunction, and the most commonly seen deficiency that we see. So I want to bring to your attention the importance of you understanding that your lower extremity provides the ball and your pelvis provides the socket. So it's a ball and socket movement. Our lifestyle typically dictates internal rotation, the inward movement of the pelvis, and a lot of times people cross their legs, or they just get so tired of sitting that they just do funky things with one leg more than the other. So to provide better strength for pelvis and pelvic floor, it is important to have proper mobility and joint centration of the hip joints. So your legs need to be able to internally rotate, externally rotate, to come closer, go away from each other, flex and extend. The issue we have is a lot of times people are able to do these things, but they lose the form elsewhere. So in order for us to do the exercises correctly, it's important for your trunk to be stable so the lower extremities can do their movements. And then for the extremities to be stable and nice and strong, while certain movements require the trunk to move slightly around the ball. We've done a lot of exercises on hip mobility, on how to start tackling the hip restriction in movements. And with that, we should start focusing on the things that actually matter. A lot of times we're jumping the preliminary steps, we're kind of bypassing them and going to much more difficult exercises for hips. Not difficult because you can't do it, but difficult because a lot of little things that have to be in place are missing. So we are moving dysfunctionally, and that is a problem. So the best exercise are all the exercises we have on our channel that have to do with hip mobility when it comes to increasing the strength of the pelvic floor, in my opinion. So make sure you subscribe to our channel. You have checked our blogs. We write a blog every week on something that has to do with pelvic floor dysfunction. And if you have any questions, don't hesitate to contact us. Until next time, take care.